I'd like us to speak about our health because our health is our greatest wealth, and our health is our own responsibility. They can only guide us, but they'll not tell us what we need to do with our health, especially when we are healthy, when we are not feeling sick. But we need to take care of our health early enough before we go and visit the doctor. That we go very fast. Our health is our greatest wealth. And today I'd like us to speak about effects of cholesterol and body fat. And first I'll define what is cholesterol. Cholesterol is a waxy substance that is found in our blood. And the liver makes most of the cholesterol, and it helps to carry it to the rest of the body and out of the system. And also we get cholesterol from the foods that we eat. And we have two forms of cholesterol. We have the good and the bad cholesterol. The low density lipoprotein or an unhealthy cholesterol. And what it does is that it builds up able to transport blood because it makes them very thin and blood is not able to flow. And also it leaves a deposit that we call plaques. And then we have the high density, which is the good one. And it helps in transporting the excess cholesterol out of the arteries through the liver, and then the liver removes from our bodies. And we have causes of high cholesterol. Number one is that it can be inherited, it can be genetic, but often it is from unhealthy lifestyle choices. So it means that it can be treated, and it can also be prevented. And cholesterol isn't bad all the time, because our body needs some cholesterol to make our hormones, vitamin D, and some digestive fluids. And our gut is our second brain. And then we also help the organs to function properly. Then but the too much either of the LDL cholesterol is bad, because it damages the arteries, which can make our heart stop functioning, and it can also increase the risk of heart disease and stroke. What are the effects of high cholesterol? Number one is that you find that these deposits that form in our blood vessels, they eventually grow and make it difficult for the enough blood to flow through the arteries. And sometimes they can form sudden clots. Most of the time we call it thrombosis, that will go and cause a heart attack or a stroke, because it will travel with the blood to the heart, and it is going to block an artery, and you find that it can cause a stroke or an heart disease. And we have some yes, if you can't hear kindly, there are people who can't hear. So we have of the bad cholesterol in our bodies. It causes cardiovascular and circulatory systems, as we have seen, and it causes plaque to build up. And what it does is that it causes coronary artery diseases, and eventually we get heart attack, we get stroke, and the other types of heart diseases that come with bad cholesterol. And then the other effect of bad cholesterol is our endocrine system. This is the part of the body that produces the hormones. And cholesterol is used to make, those are the female and the male reproductive hormones that makes us well as a man or a woman. And it affects our body. You find that if we have too much bad cholesterol, it will affect this, and we'll get thyroid. Can be either be hypo or hypo, and it is not good, because it also causes other things, reduces the male hormones and the female hormones, and it can also cause cancer, causes infertility. There are so many things when our endocrine system is not working properly that can be caused. And you'll find that it only comes from something that we are calling cholesterol. Then the other effect is you find that we say that it can cause stroke, it can cause pain in the jaw, it can also cause things like chest pain, can cause a heart attack. Is that pressure from the heart? It can burst the artery and somebody can bleed internally to death. And there are so many things, even stomach pains that can be caused by joint pains that can be caused by high cholesterol. And moving forward, 1 minute. Is that you find that then from there we have dealt with cholesterol. Let us look at fat. We have the good fat in the body, and we also have the body fat, can be good or bad. And we have many types of body fat. The number one we have is the white fat. We are going to look at it. We have the brown, we have the beige, we have the other ones that we are calling the subcutaneous, the visceral fats, and they can be good, but also they can also cause other diseases. One advantage of having the good fat is that it promotes healthy metabolism, and also hormonal levels are good. But it can also cause type 2 diabetes, can also cause heart disease and high blood pressure and some cancers if that fat is more than the body requires. And there's a way that you can measure your body fat and also the cholesterol, which I'd recommend that we do. I'd want us to briefly look at white fat. And most of the time we think that being overweight, you have the bad fat. But today you're going to see that it can be, you can have the bad fat, but you can, somebody who is not overweight can also have the bad fat. We start with the white fat, and it is what most of us think, and it makes most of our body, and it is stored around the skin and around the organs, in the bellies, in the hips, that is the buttocks, in the breasts. And this is where the body stores the fat for later to be used as for energy, because it's broken down later into energy. And this fat is useful because imagine when you lack energy, we are not able to work very well. But it also plays a large role in the function of hormones, such as the estrogen, as we saw. And if it is high, it will put us, the bad fat, the white fat is high, it will give us the type 2 diabetes, the coronary artery disease, the high blood pressure, the stroke, the hormonal imbalance, and pregnancy complication, kidney disease, liver disease, cancer, and the leptin, that is the hormones that stimulate hunger. Also, when the fat is a lot in the body, the white fat, our body does not store the insulin the way it's supposed to be stored, the sugar, the excess sugar, it stores it at fat. And then we also affect the growth hormone. You find that people, the organs sometimes are enlarging more than they should be. Then we recommend to be checked the fat percentage. Women should have more fat percentage than men. And we said that these are the diseases that are caused by high body fat. But we also have the brown fat. The brown fat is mostly in babies. Though adults, we still have the brown fat is the safe fat. It's not very bad as the white fat, and mostly it's around our neck and our shoulders. And our body is able to burn the fat to keep our body warm. And they find ways of burning the fat to prevent obesity. That's why sometimes when you find that children will eat some foods and they'll still burn it because their bodies have that mechanism. Then we have the beige or the bright fat. It is relatively new in this research, and it is between the white and the brown fat, and it can help the fat burn faster. So it's not a bad fat as per se. So we also have the essential fat. These are the fats that you need. One, our brain is a fatty acid. Our brain is full of fat, and we need to retain that level of the brain fat because our body does not generate more brain fat after some certain level. We have to replenish or and maintain the level of that brainy fat. We also have the bone marrow that is also very important for our health. We also have the fat that is around the nerves and the membranes that protect our organs, and that is the essential fat. And we need to maintain that fat because it is able to control things like vitamin absorption, fertility, and also temperature regulation in our bodies. Then we have the subcutaneous fat. This one we know that it is the one that is under on our arms, the bellies, the thighs, the buttocks, and that is the fat that the health professional or the fitness professionals use. They use a caliper, something to just hold our body, and they're able to measure our fat. Then we have the visceral fat, that is the belly fat, and it is the white fat that is stored in the abdomen and around the major organs. And that is one of the dangers of belly fat, because it is when you see yourself, you have a lot of fat around the belly. It's not good either for men or women. Men call it the public opinion. In the olden days, we used to say that a man must have that belly fat to show that publicly he's doing very well. But today we have discovered that a man is not able to see the belt. That is not very good. One, for his reproductive system. He'll not function totally as a man. He will even have infertility issues. Number two, at risk of diabetes, heart disease, stroke, even things like arthritis, and also kidneys, very good fat to have even women. And benefits of the fat. Number one, we saw that it is very good to help us in temperature regulation, to balance our hormones, better reproductive system, adequate function is in the brain, healthy metabolism, and it also helps us to balance our blood sugar. But there is a risk not the good fat. Number one is that when we have too much of the white fat and the brown and the belly fat, we can get heart disease, as I said, coronary artery disease. We can also get and also hormone disturbances. You find that people become moody all of a sudden. So we need to take care of that. 1 minute. So that is something that we need to take care of. And we need to differentiate between the good fat and the bad fat, the good cholesterol and the bad cholesterol, so that we maintain that balance. Because we can see that it is the leading causes of these lifestyle diseases. Now, what should we do when we have these conditions? Just 1 minute. I share again the screen. Sorry, I had some technical challenge. So So we need to always think about solutions. Challenges will also always come. We'll find ourselves in this situation whereby you're going to find yourself in a situation that will put your health at risk. So what do we do? Is that one is diet. We are going to look into that. And number two is rest. We need to rest enough times. We need to rest 6 to 8 hours in a day, because our body is able to metabolize at night while you are sleeping. It's able to heal itself while you are sleeping. Rest is very important. We also need to exercise. Exercise helps in burning the excess fats and converting it into energy. We also need to exercise to make our heart strong. We also need to exercise for our muscle and also for our joints, and also to produce what we call the feel-good hormones, the happy hormones. And then supplementation is not an option nowadays. We need to embrace supplementation. And that is one of the things that the developed countries have done. They have embraced supplementation immensely. Why? We are going to look into that. So one of the solutions is you get checked. You visit a doctor or a nutritionist to check the body fat and the cholesterol levels, so that we avoid getting these diseases. And if we find ourselves with the excess cholesterol and body fat, we can come back to the solution. And if you're given medication by the doctor, please take, because the doctor has done a diagnosis and they have seen it fit to give you medication. Then follow the solution I'm going to give you in case you have bad cholesterol, in case you have body fat that is a lot, and then you are diagnosed with hypertension. Like I had hypertension, but I took doctor's medication. I never ignored, I never treated myself. And then I also watched on what I was eating. And again, I was able to take some supplements. Then we embrace a lifestyle change. That is very important. Now let's look a bit about diet. Diet is what we eat, but our body takes up the nutrition. We have spoken about the physical activity. If you have excess weight, manage it. Then we need to eat a lot of whole grains. We need to eat a lot of fruits and vegetables, and less of protein. You find that a lot of the proteins that we eat have the bad cholesterol and also have the bad fat that sticks in our arteries and creates havoc in our system. Then we need to reduce on the fats and the sugars. So this is the healthy pyramid, the way we are supposed to eat. Whole grains, half a kilo every day, fruits and vegetables to boost our immunity, to be able to also remove the oxidation, inhibit oxidation in the blood vessels. It's also able to help our body remove waste, because it's another powerful antioxidant. Protein is good because if you get the protein from the legumes, another good sources of proteins, it's able to help the body metabolize very well. It's very good for the gut. It's also very good because it helps the body produce what we call the antibodies or the amino acids. And then we need to reduce, our body requires 1 tablespoonful of fat in a day and 1 teaspoonful of sugar in a day, because all the other foods that we are eating, they have either fat that is natural fat, or we have sugar that is natural sugar. So we do not need to add more into it so that our body is able to metabolize. But you find that this is the way we eat. We eat a lot of fats and sugars, white rice, white chapati, white chele. You also find that we eat a lot of nyama. We hardly eat fruits and vegetables and whole grains. We left it to the village or certain communities. And if you look at that guy, he's having the fast food. Now, somebody will say whole grains. I eat a lot of fruits and vegetables. I eat a lot of the good proteins, that is the chicken and the fish that has been skinned. And I hardly eat excess fats and sugars. But research shows that it is only a few percentage that you're able to eat. If you do not grow what you eat, and you do not harvest what you eat, and you do it organically, you're not doing it 100%. You are going to find that from the farming to the table, there is a challenge, because the soils are depleted, of the critical nutrients. The farming methods, we are no longer doing a crop rotation. I remember when I was growing up, the land could be abandoned for 2 or 3 seasons so that it's able to regain its nutrients. And then they do crop rotation. Nowadays, it's not happening. Land has been overtilled. Then you find that the treatment of the pests and diseases is bringing us a lot of havoc in terms of hormonal imbalance, in terms of the chemicals that are in our bodies. And also, we are no longer using the manure the way we used to. Very few people are using manure. Most of the time, you find that it has also become a business. The farmer sells, they don't use it. Also, the handling of foods. Look at the vegetables from the farm to the table. It will take longer for us to eat that fruit or that vegetable. So it is lost, some nutrients are lost. So you find that we will not get enough vitamins. And then you find that the proteins, the way they are handled, we get the chicken that is given hormones, the hormonal injection, even the cow is hormonally injected or given foods that are hormonally grown or are hormonally prepared for them to have faster growth. And this is affecting especially our hormonal imbalance. So we are not eating 100% right. So because of that gap, we need to embrace supplementation. And these are the foods that we need to avoid so that we don't get the cholesterol and the body fat in excess. That is the fatty beef. We have the lamb. I've spoken about the pork, the poultry with skin, dairy products, packaged foods. Those are the processed foods. That is the chips, crackers, frostings, fried foods like fries, chips, all these foods, sausage, bacon, organ meats, the matumbos and the kidney and the liver. Most of the time they have a lot of bad fat. And these are the foods that we should avoid. But there are some foods that we should enjoy eating. That is the oats, the legumes, that is the beans. You should enjoy garlic. It's very good. It's our powerful blood thinners, almonds, the eggplant, okra, need to eat nuts, green leafy vegetables, grapes, the citrus fruits, the oranges, the lemons, then organic soy and fatty fish. But that is mostly you find that those foods that I've just spoken about, sometimes they're not easy to come by, sometimes they're expensive, sometimes they're not good to the taste of the mouth, because our mouth has been trained to eat the refined foods which are tasty in the mouth. But this is what we should start eating right now, so that we so you find that the solution that Neolife will give you is that you, as much as possible, eat the right foods, exercise, and also we have a solution. And Neolife was founded by Jerry Brassfield at the age of 19. He used to have challenges of health. He used to be asthmatic. And the mother gave him supplements. He gave him fish oil and vitamins. And he was able to fight that chronic disease. And today he's healthy, can see that. And that is the daughter, Kendra, who is the CEO right now. She has taken over. She's around 27, 28 years. So the business is in his second generation. And we have a board of doctors that check on the products to make sure that they are good for us and for the environment. The product will not harm us. It was founded by Dr. Ada Fast. And Dr. Ada Fast was the guy who came up with the oral chemotherapy of cancer. But he said that he will not dwell again on curing cancer. He said the best way to cure cancer is to prevent it. So he pioneered the research in food supplements. So they have a money back guarantee. If they do not do what we say they are going to do, the company will give you a money back. And quickly, I'll mention about the whole grain. We have seen whole grain is important. We have TreeNN, it's from rice, wheat, and soya. And the rice and the soya have not been removed the critical nutrients. And the lipids and the sterols, that is the oils of the whole grains, have made TreeNN. And the work of TreeNN is number one, to feed our cells, because it's able to help our cell become soft and permeable, such that whatever we eat gets in and waste gets out. But because we do not eat whole grains enough, our cell is unhealthy. Hardly does our waste come out. And I always say, without shame, that I used to suffer from constipation. I know those are the things that you could never say. We were taught that those are things that we could not do or say. And you find that I used to have peptic ulcers. I took TreeNN. The first few doses I took, I was so much clogged up. I threw up. You can take TreeNN and you get a running stomach. Please do, because it is detoxing your body. And it shows that your body is full of toxins. I did. Most people don't react, but personally, I had a lot of toxins in my body. And today I no longer have those issues. I can eat sukuma wikis, I can eat beans, I can take lemon water, so many things. And today I'm healthy. And carotenoid complex is from the fruits and vegetables. It is able to help our body fight the diseases because it is boosting our immunity by 37%. And it's also very good for the heart because it's an antioxidant. It prevents the cholesterol from oxidating in the heart. So it is very, and also TreeNN is able to help our body metabolize the cholesterol and the fat that is in our cells. Then salmon is very good for our heart, and it is from the fish, from the salmon that is from the lake, the North Atlantic, that is from the cold lake, and it is also has all the 8 classes of omega-3, and it is clinically tested and it is pure. And it is there is no other company that has a salmon that has all the 8 classes. If you get one, bring I see. There is no other company that has carotenoid or TreeNN. Neolife is the first company in the world to have these 3 products. And the work of the salmon, number one, remember the good fat for the brain, it gives us that good fat. Number 2 is that it gives us the good fat to oil our joints. Remember, we have the synovial that is around our arteries and our heart. And it is also very good because it is an anti-inflammatory. In case we get excess fluids in our body, it removes it by 67%. Then we need minerals and vitamins. We need iron for the heart because of the red blood cell. We need the zinc. It's very good because it helps the body to produce insulin, to burn excess sugar so that it's not stored as fat. We need the vitamins and the minerals. Our heart needs calcium because our heart is a muscle, so that is able to pump and be strong. And the solution comes in ProVitality. Take a sachet a day, and you're able to turn your food pyramid right side up. And it is a whole daily food nutrition. And I'll mention briefly about products that can help us fight the cholesterol and the body fat that is excess. And we have seen that largely excess fat and cholesterol constitutes a lot of diseases that are related to the heart. I've spoken about the salmon is very good. Garlic is very good for the heart. It helps the blood not to clot. It prevents clotting in the arteries. We have vitamin E. It helps the cholesterol not oxidate in the arteries. It's also a good, it thins that cholesterol, but the blood that has cholesterol, so that it's also able to flow very well. We have the flavonoid. The flavonoids is from the fruits and the vegetables, and it's one is an anti-inflammatory. This is a product that is very good. My sister was having preeclampsia and hers was severe because she actually collapsed. She was had a pregnancy for twins, and she was so swollen that when she was in hospital and they were trying to draw blood for testing, her body was removing water. And while she was at the hospital being taken care of, after she did a CS, she was still swollen even after 3-4 days. And you know, the swelling should almost go immediately. I gave her flavonoids. I gave her garlic, I gave her salmon, gave her vitamin E, and that puffing up went. So flavonoid is also very good. And it's also very protective for the arteries. Fruits and vegetables are good, and it's a part of the fruits and veggies from the flavonoid family. Then threonine, as we have mentioned, it's very good. Then I'll speak about lipotropic. This is one product that, in case you have a cholesterol of excess body fat, or you are hypertensive, this is a product that you should take, because what it does is that, remember the plaque that I spoke about that is caused by the homocysteine levels? And what happens is that I'll
This is
give
my meeting. Take the cocomelon there.
Lydia, you are muted. We can't hear you. Sorry, I was trying to mute someone. Sorry, I muted myself. I'm sorry for that. Always find that suit that is on the roof of the kitchen when we go to visit our grandmother, and that is how our blood is because of oxidation. That's how our arteries are. The plaque forms and builds around our arteries. Now, the only thing that is able to remove that is the lipotropic adjunct. Is able to remove that because it has what we call the B-choline. So it's a very good product to take occasionally if you don't have that plaque. And I remember men, you find that they have lines on the head, and my husband was forming those lines. And I decided to give him lipotropic and threonine. And within 3 months, he no longer had those lines. And sometimes you see as if they are normal, but that is cholesterol that is around the arteries of that is in the head. So lipotropic is very good. Then we have the CoQ10. It is the coenzyme 10. Our body is supposed to produce this coenzyme 10, but because of our lifestyle, some people who have hypertension, they are given medication that have statin that stops the body from producing the CoQ10 from the mitochondria. That is the energy powerhouse that is inside the cell that I showed you when we are discussing about threonine. So what CoQ10 does is that, number one, it prevents our arteries from the oxidative damage, and it also is good for the heart and the brain and the neurons. And this is one product that we should all take, because the powerhouse is much affected even by our food, the environment, and all that. So CoQ10 is very good for the heart. Then if you have excess weight, lose it. But our weight loss helps you to lose fat and keep the muscle, and you feel full and satisfied. And number two, it also helps in glycemic response. This graph that you can see here, this is how our body behaves when we take food. When we take foods that have a lot of high sugar, the refined foods, the glucose goes up in the red that you can see. But once you take Neolife Shake, this is the way it goes. We call it glycemic response. And when the spike is like this, the difference between the normal zone and the spike, that fat is not good because it is stored in our arteries. And then it's also very good for the gut and also for the brain. And it's also very good because it has fiber. Fiber is very important in removing the soluble fiber, helps the body to remove the bad fat from the arteries, and it's also very good for the digestive system, and it helps you feel full longer. This is a product that I'm currently on, and it's a good one. It's also very good for the skin. Then we have the Neolife Tea. Neolife Tea is a product that, whether you're losing weight or not, I know we are taking herbal teas. Most of the herbal teas we are taking are good. They are good, but our Neolife Tea gives you focus and also helps you burn fat and converts it into energy. It has what we call the thermogenic enhancer that helps the body. Remember the body fat that we were talking about that is excess in our body and the cholesterol. It helps burn it into energy, and it gives you that energy that is sustained throughout the day. And we have other targeted solutions for the bone, for the stress management. We usually discuss them on Tuesdays for the sugar level imbalance, digestive for the fertility of men and women, sharper mind. The person who invited you here, in case you have interest, they can take you through, or they can send you materials that will tackle on these targeted solutions, and will not be able to go through them because of time. But now Neolife makes these products, but they tell you that you can come in as a customer, or you can buy from the person who has invited you. And if you decide to buy, the company will do a lot for you. They are going to do warehousing, they are going to do the registration, the research and development, and transportation, and you're going to get the product at the door. So you can come in as a customer, or you can be sold to by the person who has invited you here. And or some people, you find that they come in and just want to consume the products without doing the business. That is me. That is what I was looking for. And I found myself selling because people asked me what happened. And I gave them my story, and they started becoming my customers. I made profits. Then I became a business builder eventually, and today I do this business as a career option. So there are benefits that you're going to benefit when you become part of Neolife. And number one is personal growth. I could not talk to two people at the same time. Today, I'm more confident than I was. Leadership development is something that we are given a lot. We start training and the baby steps. International travel. Out of wanting to improve my health, I've been able to travel to South Africa, to the UK. I've also been able to go to Windsor. We are going to Prague next year, that is in Czech Republic. And then you retire healthy and active. Today, there is no greater asset than health, because you can make all the money in the world, but if you are spending it in the big hospitals because of something that you could have prevented, it's not advisable, and you're able to build a lasting relationship. Some people today are closer to me. They are my family, and I never knew them. Courtesy of this business, we speak every day. We are connected. We are a family, and then earn residual income from the effort if you decide to do it as a business. So I'll stop there. I'm going to stop sharing, and because I'd like us to finish in the next 3 minutes. I'd like to invite my friend, the people around her, and maybe she can have some add-ons. So Gladys, if you can hear me, please proceed.
Can you hear me?
Yes, yes.
Thank you so much, Lydia. God bless you. Even for the friendship we've had, I don't take it for granted. My name is Gladys, and between Lydia and I and some people we have here, the other directors on the call like Emma, Karima, and other leaders, we decided to be doing this meeting together to keep learning ourselves. You know, when you do these things, you learn also, and you impact other people. So for me, I always look forward to this meeting every Tuesday at 7. My name is Gladys, very, very excited. And I'm a mother of 2 beautiful girls, so I'm speaking as a parent. My firstborn is 27, going 28. My secondborn is 21, going 22. I came into this opportunity like Lydia, looking for a business opportunity, but I fell in love with the health part of it, because that's the core business really. And based on the pyramid Lydia has showed us, I remember vividly being showed that pyramid on my second meeting by Dorothy Nyong'o, Anyang' Nyong'o's wife. She was very eloquent when she was being my first teacher. She was very, very eloquent. She taught it. And I knew as a mother, I was doing the wrong things. And I thank God because that was my turning point. And from there on, I made this a career. I wanted to have a healthier family. We had our own challenges. My daughter had, the firstborn had serious tonsillitis. The secondborn had serious bronchitis. My brother and sister were challenged. And I thank God for those years that came, we were able to learn so much. And so for me, what can I say about we thought we talk about the cholesterol part of it, because we are normally told your first heart attack can be your last. That's how bad things can be. And the highest killer in the world today, the number one killer, is the heart diseases combined with stroke. And so it is good for us to learn these things, very, very important to learn these things. And one of the things is that we can be able to tell the signs of whether we are doing well or not by how we are feeding our children, how we feed when we go to parties with our parents and friends. Based on what Lydia has taught us, we're able to tell whether we are heading to that level where we could have challenges of heart diseases in our families. Eating fatty foods, a lot of refined food, vis-a-vis what we've been told by Lydia. Doing a vegan, more like a vegan keto kind of diet. The other thing is that when you look at the way we've been told about diets, then the other thing is exercise and rest. Are we doing it right? Are we not sleeping well? Are we not exercising? Even when we are treating our parents and they have challenges, the question is when you go home, the person who has a health challenge, do they just sit, or are they having an active life where you tell them, Daddy, Mommy, as much as you're not well, we need to take a walk for like 10 minutes and back. You know, you need to encourage them that a body needs movement because the heart is beating, the muscles need to do their work, the nerves need to do their work. All that is part of a good heart program. And then you learn to listen to your body. If you're on this call, you must learn to listen to your body and listen to what people are saying. When you hear somebody says, I'm very tired, I have fatigue, that's a big one to look at. I have swelling on my legs. When you have swellings on your body or your legs, that's a very big one. You have palpitations. I have a testimony. Personally, I'm very slim. Okay, not very slim. I range between 50 to 55 kgs. When I go too much, it's 55. So like 4 years ago, I love peanuts, I love nuts, and I love eggs. 4 years ago, I went to the office. And while I was in the office, the previous nights, I realized I was getting palpitations. They were really bad. Have you ever gotten palpitations where you're praying and saying, oh my God, who can I share this with? You don't want to tell your children because you scare them. And I got those palpitations for a week and they were very serious. Then one day I walk into a meeting. I love going for meetings to learn. And I remember that day they were teaching about lipotropic adjuncts. And the lady who was teaching had been a nurse in the US for many years, but now she's back. And she explained the foods that can have you get palpitations or body fat and cholesterol. And she talked about eggs, she talks about nuts in excess. And I sat down and I was like, oh my goodness, this is where I am at. I remember leaving that room quietly, went and got myself my lipotropic. I took 2 tablets immediately after that meeting, 2 in the evening. By the following day, I have never had palpitations to date. Of course, now I learned what I need to control, and I learned what I need to do occasionally to make sure that my body fat and my cholesterol is tamed. So you must learn to listen to your body. If you start getting palpitations, ask yourself, what is happening? What is happening here? If you have a pain in the chest, very bad pain in the chest, that could be a sign of angina. Angina gives you very bad chest. And there are people, especially men ignore pain. They think they are very strong and they can overcome anything. And when you ignore some of these things, now the problem starts becoming more and more and more. And that could be very dangerous. Something else to think about is clots. The minute you're told you have clots, that is something that tells you that you need to tread very carefully and really make sure that your diet is at its best and doing the right thing. Another thing is numbness. Now, let me give another story. 2 months ago, a friend of mine in Eldoret called me. 4 months ago, he told me he has been diagnosed with high blood pressure by the doctor. I sent him all the necessary information. I told him to go to the Neolife University and acquaint himself with those symptoms and immediately know what to do. Well, we will continue. He didn't seem to tell me anything. Then 2 months ago, he told me he's having numbness on one of his fingers, the long fingers. And he told me, Gladys, this finger is disturbing me. Inanisumbua sana. And over the years before that, he had used to tell me he has a bad pain here at the back, at the shoulders, very bad pain. And so you see, with that ignorance over the years, now he has been diagnosed with high blood pressure. Now he has a numbness. In exactly 2 days, while he was jogging, he actually collapsed. And my good friend for many years, who was a colleague of mine at the Co-op Bank, that was the end. And when I look back, I'm like, oh my goodness. The signs were there, but because of that postponing and ignoring and not being checked, there it was. And when you're checked and you're told by the doctor, this is it, always try to find out as a person, what can I do? On my own side, in terms of health and diet, because we see very many people taking medication, right? But their symptoms don't seem to calm down or improve. So it is good to work together with it, because any doctor will always tell you go to a nutritionist. In your own right, you can learn these things. If you open up your mind, you can learn these things. The other thing you need to look at is if you're taking too many medications, then there's a sign that all is not well in your body. Just to mention a few. So that's where we are at, especially in heart health. Finally, I've helped quite a number of people who have had heart issues. One is a friend of mine who came into the other day just and did something. She came in, she told me she's having diabetes and sugar issues. We went through the program. She took her ProVitality. She went on ProVitality. She went on Lipotropic Omega-3 Calmag. Now she's a very active lady, very happy. I know she could be here on the call, but she's not here because she lost someone just the other day. And she's very happy about her health, and she's up and down. And she cut some bit of weight. Along the way, she's cut some weight and her sugar levels are controlled. So if you're on the call, let me just stop it there and say, thank you very much for coming to join us. And it is always a pleasure when we learn together. But the thing is, keep learning more. Keep wanting to understand. You know, the body is very, the systems are many. We have the nervous system. We have the circulatory system. We have the skeletal system, the reproductive, respiratory, digestive. All those systems, you need to understand them back and forth as much as you can, so that you can be able to help yourself and the people around you. Otherwise, back to you, Lydia. Thank you very much. And for everyone who is on the call, we really appreciate the time you've taken to be with us. And as always, the link you've been sent today, even if somebody forgets to send you the link, it's still the same link we use every day, only that we look at different issues that affect our health and our environment and the farming part of it. Because we also encourage people to farm with something that will not be too much. Otherwise, thank you very much. God bless you.
Thank you, Gladys. That was awesome. You reminded me that when you have said that you don't have much weight. And I remember also my mother is 48 kilos, 48, 50. And she also had bad cholesterol, caused a stroke. And the doctor was saying that she's underweight. That now she's back to her basics, and we give her a lot of these products. So it doesn't matter you are at, it is doable in matters of health. So I'd like to encourage you, come and we join hands, begin this journey of taking care of our health. We also work there, but every day we work on our health. Get in touch with the person who has invited you here. Ask them how you can get started on the product or the business. And for us distributors, if there's any product that I've discussed there that you do not have, maybe it is CoQ10, maybe it is garlic, maybe it is vitamin E, please make a point of buying this month, so that we lead by example. We become the product of the product. So thank you so very much. God bless you. See you at the top. Looking forward to seeing you in other meetings. Good night and God bless you.